ninth in the series of PSR's Healthy Climate webinars. The title is The Clean Power Plan, Progress and Challenges in the States. I'm Paz Abdassa Regan, and I'm the climate organizer at Physicians for Social Responsibility. Other PSR staff on the webinar tonight are Barb Gottlieb, Director of Environment and Health, and Julia Morgan, PSR's webmaster. As we get started, I just want to give you a little history. As some of you know, the Clean Power Plan was finalized this past August. This has marked an important milestone. The Clean Power Plan work now truly moves from the federal level to the state level, and it is there where your voice and advocacy will be truly critical. States have 1 to 3 years, depending on if they're submitting as an individual state or as a regional group, to submit their Clean Power Plan state implementation. During that time, they're going to be required to hear from various stakeholders as to how they should implement the CPP. You are one of the stakeholders. Your voice is critical. The webinar is meant to give you the information as to how two PSR chapters are tackling the work on climate change, clean energy, and the Clean Power Plan, and how they're planning to raise the health voice in their state implementation plan process. The two states are PSR Texas and Chesapeake PSR Maryland. They have very different challenges and opportunities. We chose them because of that. We hope that some of these challenges, opportunities, and goals and strategies that they're going to be talking about will resonate with the challenges and opportunities in your own state. We also hope this will give you ideas as to how you can participate and raise the health voice in your state's CPP implementation plan. Before we get started, there's some important information. Barb will be moderating the question and answer session. This is going to be an important part of the webinar. I want to be very interactive. I encourage you to ask questions and join the discussion. The webinar is going to be recorded and will be up on the PSR website sometime tomorrow. We will be taking questions after both of our guest speakers have finished presenting. You can ask questions in two ways. If you look at your little sidebar, you will see a box of questions. You can type those questions in the box, and we will read them out during the question and answer time. Or you can raise your hand. You can see the little yellow hand symbol up there on the upper right-hand corner next to the bar. That is where we will unmute you and call on you during the question and answer time. Now, you need to have either a microphone or be on the telephone to be able to be unmuted. I also encourage you to stay tuned for this month's action after the question and answer session. At this point, I'm going to start by introducing our two speakers. No, not yet. Julia, can you go to the next slide, please? Before we get started, we always go back a month and look at how we did on our action request for the month before. Last month, we asked that you write to your members of Congress asking them to support the Clean Power Plan as a means to create significant gains in health. Over 1,800 letters were sent, and I'm very thankful for that. That is an amazing accomplishment for a PSR. Next slide, please. We have two presenters that I'm delighted to introduce for today. The first speaker will be Dr. Sara, and the second will be Trish O'Day. Sara is the professor of biology at the University of Maryland and co-leader of Chesapeake PSR Climate Health Action Team. Sara obtained her BS in zoology at Duke University and a master's in science in insect neurobiology at the Australian National University, and her PhD in zoology and statistics at Duke. She's also done postdoctoral work at the University of Chicago, University of Iowa, and Cornell. She is in association with the Maryland Master Gardeners and Chesapeake Physicians for Social Responsibility. She is in a variety of community groups, works with high schools and universities to increase awareness of the scientific reality of climate change. And as I said, she's the co-leader of the Chesapeake Maryland Chat. Our second speaker will be Trish O'Day. She's a board member of both the Texas chapter of PSR and also on the national PSR board. Trish is a clinical nurse specialist in community health. She's currently a consultant in population health and environmental health, and she's worked at the faculty of the University of Texas at Austin School of Nursing, teaching public health nursing, and continues affiliated with the Environmental Science Institute. She's been a registered nurse for over 20 years and has experience in public health, health policy, healthcare administration, managed care, and maternal and child health nursing. I'm delighted that both Trish and Sara have joined us today to talk about how their chapters are tackling the issues of the Clean Power Plan, climate change, and clean energy. Sara, you're going to be going first, and then followed by Trish. So Julia, if you could get Sara's first slide up.
Okay. Hi, everybody. Can you hear me all right? Am I unmuted?
Yes.
Okay, great. So this is Sara, and I'm the co-lead of the Maryland Chat with Dr. Al Bartlett, and we've been working very closely with Tim Whitehouse. He's really helped so much. He's the executive director of Chesapeake PSR, and he had already, before the chat started, a lot of experience in advocacy, and he has a huge network of collaborators, so we were able to join in on that and take advantage of his experience. Next slide. So I want to tell you a little bit about where we stand on this Clean Power Plan in Maryland. Maryland could have a really easy time meeting the Clean Power Plan targets because we have various existing programs in place, and 3 of them are likely to be more than adequate to get us to the target that EPA has set. The first one is that we're a member of the Regional Greenhouse Gas Initiative, affectionately known as Reggie. We have a program, state program, for energy efficiency through Empower Maryland, which is run by the utilities. And we have a renewable portfolio standard, RPS, which specifies that 20% of energy use should come from renewables by 2020. So these are 3 of the 10 main programs established in 2009 in Maryland under a law that was passed in 2006 called the Greenhouse Gas Reduction Act. And the goal of that is to reduce CO2 emissions 25% by 2020. So I just recently found that the formal SIP work for the CPP in Maryland, Clean Power Plan, will not begin until 2016. And I'm not really clear why we're having this delay. It could be a variety of things. Next slide. But we're having a political transition. We've had 8 years of Martin O'Malley as governor, Democrat Martin O'Malley, and now we have a Republican, Governor Hogan, and he has really not revealed how he's going to handle the climate plan and all the Greenhouse Gas Reduction Act and all these programs that Martin O'Malley started. And in fact, as far as I can tell, we're still just working along with the O'Malley structure. We're still on that same road, and even some of the websites that we can go to about these programs mention Governor O'Malley. So I don't know what Governor Hogan is doing, but he is in general very pro-business and anti-regulation. This is absolutely clear. His first act as governor on his very first day was to block a regulation that was virtually complete, to require coal-fired power plants to reduce NOx emissions. And this was shocking to all of us in the environmental community. And since January, basically the MDE has sort of revamped this rule to be very much weaker. And so the main work that we've done in the Maryland Chat this year has been to testify and advocate to try to get the NOx rule reinstated in its strong form, because we have 7 generating units in Maryland that don't have good pollution controls, and they need to have those. So Hogan's actions with this very important air pollution regulation makes me wonder how he's going to behave when he starts dealing with the Clean Power Plan. So that's why I put trouble on the horizon. It's really not clear what's going to happen. Next slide. So the current focus of the environmental community is not the CPP right now, but it's renewing the Greenhouse Gas Reduction Act, because that's going to sunset next year if we don't do something about it. And that's the legal framework within which Reggie we're in Reggie, and we also have the energy efficiency thing. So that has to be renewed. So CPSR and the chat have been working with the Sierra Club and a coalition of, well, the Sierra Club's in this coalition of 16 other environmental groups. So this is huge that we're able to interact and exchange information and collaborate on advocacy with a variety of other environmental groups. So I don't know how it is in other states, but if you have an opportunity to hook up with other advocates that will be speaking for the Clean Power Plan, I think that would be really good. So what we're all trying to do is to make the Greenhouse Gas Reduction Act more aggressive. It's 25% now by 2020. We want 45% by 2030 and 90% by 2050. We're trying to strengthen the various programs under GGRA, and also we're working to increase awareness of climate change and its health impacts in Maryland. And we actually have a hard time with outreach, because in order to increase awareness, you have to get people, to listen to you in some way. And so I think that's a challenge. I don't know if the rest of you have had a challenging situation there. Next slide. So I just want to talk about the three components, the status of Reggie. Reggie is really strong. Probably some of the rest of you are in Reggie states. And a recent report by the analysis group, it was really helpful, I think. It has documented that there was a big economic benefit and measurable electricity cost reductions in Maryland from Reggie, which is a cap and trade program. Reggie's going to have a program review early next year, and some alterations are going to be required to facilitate the Clean Power Plan. The Reggie states have, in general, fairly non-stringent targets issued by the EPA, but the people in the know with Reggie expect that the leading states like New York and Vermont, and I'd like to think Maryland is in there, will reduce carbon dioxide much beyond the Clean Power Plan targets. And that can happen. There's no question that that can happen. So CPSR and the Maryland Chat are now involved with this Reggie Advocates Group, which is a number of other environmental groups. And Paz hooked me up with that, so thank you, Paz. We have another sort of Reggie issue in Maryland, which Al Bartlett, my co-lead, found this out. It turns out that unlike the other 8 Reggie states, we in Maryland spend more than 50% of the revenue just on paying people's bills in low-income situations. So this is direct bill assistance. All the other states are plowing the money back in to support energy efficiency and renewable energy. We're going to have to deal with this in Maryland, because that's not really an appropriate. It's a very valuable thing to do, to give people bill assistance, but it's not really the right way to use the Reggie money. Okay, next slide. Empower Maryland is the energy efficiency program that we have under the Greenhouse Gas Reduction Act, and right now it's supposed to be reducing demand 15% by 2020. Reducing both the peak demand plus overall demand. And right now we've succeeded in reducing peak demand 15%, but we're lagging on reducing overall demand. So that's going to have to, they're going to have to pick up the pace on that. The good news about energy efficiency is this summer, the Maryland PSC, Public Service Corporation, I don't know, I forget, voted to require that the utilities reduce demand 2% every year by implementing incentives and programs and whatnot. And the big the big issue here, the big gain here is that in formulating this regulation, they included social costs of carbon dioxide in the cost-benefit analysis, which makes it much easier to justify many energy efficiency measures as being cost-effective. So we're really glad that that happened. And again, we're not quite sure how that's going to be implemented. Next slide. The RPS is a bit controversial right now. It requires 20% renewables by 2020. Solar is growing really fast in Maryland. We've got a huge offshore wind project started, or they're planning it. So we've got a company and they're planning it. They have a lease, and hopefully they're making progress. We passed a legislation for community solar, but legislation to increase the RPS to 40%, and then we dropped back to 25%, failed in 2015. And the definition of renewable energy is not necessarily clean energy, because there are a lot of combustibles, things that can be burned, like black liquor from making paper, and poultry incineration. They're all included in this tier 1, the preferred tier of the RPS. So we're trying, the environmental community and PSR is trying to increase the percentage RPS and to cap or eliminate the combustibles. So this is going to be a big issue in the 2016 session. We only have a 3-month legislative session here in Maryland. So next slide should be the last.
Sarah, somebody's just asked what RPS is.
Oh, I'm sorry, Renewable Portfolio Standard. It means that there is a requirement to get a certain fraction of power that's used in the state from renewables. I'm sorry, I thought I defined that, but yeah, thank you very much, because I can see that this slide is like acronym soup. So I'll speak those out when I get down to challenges. Our next step, energy efficiency advocacy, is going to be a big part of what we do now, because that's going to be very big in Maryland now that the PSC has made that ruling. Al is working to sort of monitor the rollout of community solar, which is going to be pilot projects for a little while. Al and I are both working on environmental justice issues and energy use, and we're again trying to persist in educating Marylanders about climate change. Not too many people in the state seem to quite grasp what's going on at the moment, and so we need to make a bigger push on that. Our challenges, we might have a very bad political climate in the next legislative session, I don't know, for the Greenhouse Gas Reduction Act, the Regional Greenhouse Gas Initiative, and the Renewable Portfolio Standard, and the implementation of the CPP. Al and I would love to be able to think we could influence how the Reggie funds are spent, but I think that's probably a long shot. We are trying to figure out how to be most effective in facilitating energy efficiency and community solar in low-income communities. And again, challenges how to broaden our educational efforts. So most of, well, let me put it this way. Our job in terms of being recognized as a stakeholder by Maryland Department of the Environment when they formulate the SIP has been greatly facilitated by being in this coalition of environmental groups. So Tim had made Chesapeake PSR well known to all the state people before we even came on board. So that made it easy for us. I see there's a question. Should I answer this? Ask Sarah to explain Reggie.
Can we wait till afterwards, perhaps?
Absolutely.
Why, go ahead. Go ahead.
So Reggie is the cap and trade program that 9 northeastern states participate in. So basically, they decide how much carbon pollution they're going to allow, and they sell permits to pollute up to that amount. And states can trade these amongst themselves. I think just amongst themselves. I'm not sure about that, but. So it's a cap and trade program, and it's been really successful, both economically and reducing carbon emissions.
Right, and just for others to know, it is a program that might be replicated in other parts of the country as well.
Yes, absolutely. In fact, in the Clean Power Plan, EPA has been encouraging states to get together and form these regional sort of trading groups. and they're incentivizing that by giving extra time to formulate these trading coalitions. And I suspect there'll probably be other initiatives like Reggie. Well, there is one in the West Coast. California, Oregon, and British Columbia are in one. But there's nothing in the middle of the country so far.
Right.
So that's all I have to say.
Okay, well, thank you, Sara. At this point, I invite Trish to get ready.
Hi, can you hear me? This is Trish.
Yes, we can hear you.
Okay, thank you, Paz. Well, there's a lot of action going on in Maryland. Congratulations, Sara. We have a little bit different situation in Texas. But I'd like to tell you a little bit about how we are advocating on clean energy and climate change here in Texas. We are a small chapter in a big state. We used to be called Austin PSR until about a year and a half ago, and then we did expand statewide, and now we're Texas PSR. So we've had a little bit of success in being the health voice in Texas. Go ahead to the next slide. I want to tell you a little bit about Texas because that might help you understand where we're coming from and where we're going and not going. We're a large state, a big state. Our population is 27 million. Almost 20% of all Texans are below the federal poverty level. That's a lot of poverty in the state. Our Hispanic population is growing. Almost 40% of all Texans are Hispanic. And in the under 5-year-old age group, they are the majority population, the Hispanic population. So why am I telling you this? Because the demographics and the economic facts about Texas have a lot to say about our policies and our politics and voting habits and voting trends. Uninsured. We, Texas, I'm not saying this proudly, Texas has the largest number of uninsured persons in any state. We are getting better due to the Affordable Care Act, and we're now down to 17% uninsured, down from 1/4 of the population being uninsured. Our state budget in Texas is $210 billion. It's a biennial 2-year budget, $210 billion. That's the 12th largest economy in the world if we were a country. So that kind of just sets the stage for Texas. We also have our own electricity grid. It's called ERCOT, and that has some pros and that has some cons. So next slide. Now let's stick with Texas. Unfortunately, Texas leads the nation in greenhouse gas emissions from electric power generation. And that's mostly due to coal being such a major part of generating our power, coal plants. So we are on track, though, for meeting this goal of the 34% reduction in carbon pollution from power plants by the year 2030. That's the Texas goal. We would be on track for that. And the way that this might happen is if we continue on with the planned retirement of some of the older coal plants in the state. We do have two of the 5 dirtiest coal plants in the nation. One's in East Texas and one's near Houston. So here's how we might meet our goal, by continuing to retire the coal plants that are already planned for retirement. We're already a leader in wind energy production. We're a really sunny state, and we can grow with solar energy. And some say, but PSR does not say this, but I'm telling you so that you'll know what other people are saying, that Texas has a lot of natural gas resources. That's not PSR's position for many different reasons. Fracking is one of them, and that's a whole nother discussion. So let's move on to the next slide. So what are the challenges in Texas? We're a very conservative state in our leadership, and we've historically been anti-Washington, D.C. and anti-federal government. Texas will not be developing their own state plan for the Clean Power Plan. And so, just like any other state that doesn't develop their plan, the federal government will develop the Texas State Implementation Plan. And in addition to that, Texas is going to sue the federal government to halt the CPP, just to make sure that everybody knows what our political climate is here. Let's move on to the next one. So in spite of all of this, I think it's important that we can talk here in Texas, and we can demonstrate how we are making steps towards raising the health voice for climate. It's not just CPP, but climate and renewables and energy efficiency. If we were asked to talk about water resources, we would be glad to talk about that from the health perspective. And our strategies for doing this, for being the health voice, are partnering, aligning with traditional medicine, and working at the local level. So our partnership has been going on. We've been a chapter here for 10 years. First it was just Austin, but more lately it's statewide. So we have been partnering with the environmental groups for the 10 years that we've been around and alive as a chapter. So these partners of ours, the environmental groups, and Texas Impact is an interfaith group, they reach out to us when they need the health voice spoken on the environmental issue. And we've had some recent successes. We were really very happy and proud that we had 3 op-eds in major newspapers in the state of Texas. One was the Austin American-Statesman, Houston Chronicle, and the McAllen Monitor. And those were, all 3 of them were in partnership with Environment Texas or Texas Impact. We were also mentioned in, I think it was the Pittsburgh Business Journal, because it picked up the Houston Chronicle op-ed. So we're moving beyond state boundaries. Also for partnership, we want to continue our coal plant closure work. We are hoping that we might get a small grant from a foundation in conjunction with National PSR that will allow us to work with, for example, the Sierra Club on targeted coal plant closures, like a specific one in a specific part of the state, and to be the health voice for that work. So we're hoping that we can continue with that. One of our big new mechanisms or ways of raising the health voice for climate in Texas is to align with traditional medicine. We started thinking a couple of years ago, well, we've been working with the environmental groups in Texas, and that's fruitful. But the power is with traditional medicine in Texas. In other words, Texas Medical Association, which is also a conservative organization. So we started meeting a few times with TMA, the public health staff at TMA, and had cordial conversations and dialogue about environmental health issues. We started that a couple of years ago. Last year, we decided to join the Texas Public Health Coalition, which is sponsored by TMA, and its purpose is to work together on legislative priorities. And we wanted to join the big boys. All the major health organizations in Texas are a member of this coalition. Texas Medical Association, Texas Hospital Association, the Texas Pediatric Society, and other organizations like that. And so we paid our fee and joined the coalition and have been a partner working towards legislative priorities with Texas Medical Association and the coalition. Now, most of the priorities in this coalition are traditional public health priorities, such as childhood obesity. Well, you can't get kids out walking if the air quality is really poor and it's an ozone action day. So that's the kind of thing that we can bring to the table, kind of quietly mention when those priorities are being decided upon, and then strategies are being developed for working with the Texas legislature. Other traditional public priorities, public health priorities that were worked on with the coalition were, let's see, childhood obesity, vaccinations, smoking, no smoking in public places, kinds of legislation statewide, and distracted driving, which is texting while driving or DUI. So we saw an opportunity in smoking bans to start the conversation about, well, perhaps we could talk about air quality, and we could talk about clean air. And so we're having those conversations right now to get ready for the legislative session in 2017, and are getting some positive feedback about that. Yes, that might be a good idea. Let's look at air quality. Let's look at some of the root causes for why kids are sick. Then the other strategy we have is working at the local level. For example, there was a recent panel hosted by the Austin mayor. Steve Adler is our mayor, and the city council members were there, and the local state representatives, and we were there. PSR was there. It was held at City Hall, and I spoke last for PSR as a public health nurse and what the Clean Power Plan would mean to the health of the public. Next slide. So what are we going to do in the future? What are our strategies for Clean Power Plan and for climate work? We want to continue those partnerships that we've already developed, and we feel that they're only getting stronger, as evidenced by being asked to have a quote in somebody else's press release, or to come to a press event, or to participate in a panel like we did in Austin, or not. It also happened in Houston too. And in addition, we really want to strengthen those relationships with traditional medicine and other health professions. As I mentioned, with traditional medicine, we're a small chapter. So if our message can be conveyed to traditional medicine and all the doctors in Texas and all the nurse practitioners, how wonderful would that be? We also are getting a brand new medical school here in Austin, Texas, and so we see in the future that we can work with medical students. We have a history of delivering a lecture every semester at the School of Nursing here at the University of Texas. So these are ways that we're strategizing and moving forward. Maybe we're not going to have a Texas state implementation plan for the Clean Power Plan, but we can be ready and be at the table when the federally developed plan comes to fruition. So that's it for Texas.
Thank you so much, Trish. At this point, we're moving into the Q&A discussion moment, and Barb is going to be moderating it. I remind you that there's two ways to ask questions, and that is to type them in the little box that says questions on your panel on the right, or where you see the little hand icon, click on that and we will call on you and unmute you at that point. Barb?
Oh, thank you very much, Paz, and good to join you on the webinar. Let me actually just start by saying that due to some technical difficulties, there's only going to be one way to ask questions tonight, and that is to actually type them into the question box. So you'll see that on your control panel off to the side. Don't use the box called chat, please, because I'm not monitoring that. But in the one that says questions, just type in your question and send, and I'll read it out and we can answer. And so we'll get started with that in just a minute. I'm going to give you guys a few minutes to write your questions down, with apologies to those of you who wanted to raise your hand and just speak out. I know that can be a lot easier. But I thought I might, while we're waiting for more questions to come in, I would like to get the ball rolling by asking one question to Sara and one question to Trish. So, Sara, you've got a really robust program. You've got a lot of opportunities through Reggie, through the state's environmental energy efficiency work, and so on. I'm just wondering how it works for the chat and for the PSR chapter to be recognized as a health voice. What do you do to recruit health professionals into your organization, and how are you received as a health voice? Sara?
Am I okay now? Just as Trish said, the environmental organizations that we partner with call on us often to talk about the health impacts of whatever issue is at hand. So when we were working on the NOx rule, we were very active in explaining about ozone and the health impacts of ozone and NOx NO2 directly. Recruiting, Tim's been working really hard on the website and trying to draw traffic to the website, and we've been trying to put a lot more content on the website in the sense of fact sheets and other information, again, to give the health impacts of the various climate change issues that we're dealing with. I think we're recognized as having some authority on the health voice, and that's how Tim is really trying to position us in that. We don't want to just be another environmental group, but we really want to talk about the health impacts of climate change. Recruiting is a challenge. It's hard to get people to commit to do anything.
Right. Okay. Thank you, Sarah. Trish, let me ask you a somewhat different question. You're warning us that we should not expect an implementation plan to come out of the state of Texas. Things are going to be a little bit more contrarian there. And you're very clear that you are working as a health voice and through the structures that other health professional societies and so on work through. What do you see? How do you gauge the likelihood of actually getting policies passed in such a state that's as red and conservative as Texas?
I think it's a bit of a dim future right now, the way it looks, to tell you the truth, Barb. In our legislative session that we just had, instead of tending to needs of the Texas population, our legislature focused on abortion, how to prevent same-sex marriage happening, and guns. And now we have open carry and campus carry in Texas. Guns. So I'm not sure things are going to happen with our current state government, our current state leadership. And so we'll have to keep brainstorming on other ways for initiatives and right action to move forward. Slowly, it's going to be slow, and that's fine. That's what we decided to do, to work slowly and develop relationships with traditional medicine.
Well, more power to you. I think that it sounds like a realistic and a forward-looking policy in a state as difficult as your own. We have a couple of questions here. Let me read out the first one. Someone was asking if we can get copies of that cost-benefit analysis for Reggie. It might be something useful, certainly for the other Reggie states, if people from many of the, let's see, Maine is a Reggie state, I think, Massachusetts, New York, a number of the northeastern states are, so we'd like to get a hold of that for them, but also the questioner was saying it might be useful for making analogous arguments in other states. So, Sarah, can you tell us more about this cost-benefit analysis of Reggie?
Yeah, there's actually 3 reports that are out now. One came out in June or July from the analysis group. That's a consulting group, and I have all 3 of these as PDFs, so I can send them to you, Barb, and you can put them on the website or send them out to people in the Reggie states as you would like. I don't have them right in front of me, so I can't quote numbers, but the economic benefits, I think, overall to all 9 Reggie states were something over $1.5 billion came back to the states by selling the permits for CO2 emissions, and most of the states are spending that, putting it right back into energy efficiency programs and renewables. So that's a really good way, I think, to spend that money. So I'll send, Barb, shall I just send you those 3 as PDF and you can distribute?
That would be perfect, Sarah. Thank you so much.
Yep.
Actually, if I could just follow up on that with a question that I have about how the cap and trade program works under Reggie. I understand that there's a limit that's set on pollution, and then in order to pollute even to that limit, polluters have to buy the permits, kind of buy their way out of jail, so to speak. But yeah, does that limit come down over the course of time so that there's a kind of absolute reduction in CO2 emissions?
Yes, it does. And I can't remember exactly how much the cap has come down, but it has been reduced over time. And one of the modifications that hopefully will be made in the program analysis period next year is to reduce the cap not by a percentage. I think it's reduced now by a percentage of the previous year's emissions, and they want to have it reduced by a constant, fraction of the initial emissions, say, because, well, we won't meet our clean power plan targets if they keep a percentage of a constantly shrinking thing is clearly going to be shrinking, and so by the end of 15 years, where the cap is not nearly as low as it should be. So that's a modification that will be made. But the cap is definitely going down, and the market forces drive the price of these permits. Yeah, you can't emit anything without a permit.
If I may, I was just on the Reggie call today. This is Paz, and something that was very interesting that came up was that the auction of these allowances are 9.5 times higher in price this year than they were the last time.
Right.
And that is partially because the allowances are coming down, so there's the price of them is that people want to pay for them is going up. Just this auction brought in $152 million in revenue for Reggie.
Right.
Thank you, Paz. Now here's a question I think would be best addressed to Trish. The question was in regard to partnerships with Sierra Club that are targeted at specific coal plants. The question was, how do these partnerships come about? How do you how do you get into that game? Something that PSR has been working with for a number of years. So, Trish, would you like to tell us how it's worked, at least in Texas?
Yes. Well, we've been in existence for 10 years, and I think from the very beginning here in Austin, we would communicate and have dialogue with the Sierra Club, and it's ebbed and flowed over the years, but it's been a pretty positive relationship. And we are asked to be the health voice on some of Sierra Club's initiatives, and we are glad to do that when it's an initiative that we agree with. For example, we're not working with them on fluoride, water fluoridation. But we are glad to partner with them, and we did work with them in some of the coal plant closure work that we did, was it a year and a half ago, Barb, or 2 years ago?
That's right.
Some of this would involve attending the strategy sessions that the Sierra Club holds, and doing some research from a health perspective and providing that back to whoever the environmental group partner is. So it's kind of a give and take, but they are the larger organization in our town than we are. But yet we have a unique skill set and a unique profession that we can bring that I think that's very much needed to these issues of what's going on with the health of the public and communities that live downwind of coal plants.
That's a really important point you're making, and I think all of us who are on this call, whether as PSR members or as health professionals or as allies, really recognize that it is this unique value, the expertise, the authority of health professionals, and the respect in which health professionals are held really means that when we speak out on these issues, we're listened to, and we've certainly found that our environmental allies know that and appreciate that. In a lot of places, and even in places that are theoretically progressive, there's a certain skepticism sometimes towards environmentalists, and so for the way that you're working very deliberately, Trish, in Texas, in terms of maintaining a clear health voice and working through health structures, means that you are viewed differently, and your input is perhaps assessed a little bit differently. Now, this funder had a couple of other specific questions about the alliances with the Sierra Club, is there joint funding, joint staffing, or anything like that, or is it basically a question of holding common objectives, strategies, and tactics?
Is that question for me, Barb? This is Trish.
Yeah, Trish.
Yep. Yeah, we don't have joint funding. We had gotten a small amount of grant funding through national PSR that came to Texas PSR to do this work. And to do the work, you have to partner with the environmental organizations that are doing the main bulk of the work of coal plant closures. And that could be this other organization called Environment Texas. I think on another one of our webinars we heard from Environment America. And so Environment Texas is a chapter of that organization.
Okay, thank you. I don't see any more questions posted right now. Pause, just tell me, do you see any more questions?
No, I think that was it.
Okay, well, if anybody has any more questions, shoot them on in right now, and I'll keep my eye on the question box. But might be a good time to talk just a little bit now about some of the transitions and changes that are happening within our own climate health action teams. So as Paz already told you at the beginning of this session, since the Clean Power Plan was formally announced in early August, really the action has shifted to the states. And that's very exciting because it means that you as our members and participants in PSR and in these climate health action teams, you are where you need to be. And you need to be finding ways to hook into the decision-making bodies or the advocacy bodies that are going to have some influence in what those decisions may be. So why don't we go to the next slide and take a look at the current action. Okay.
Barb, do you want me to deal with this one?
Sure, go right ahead.
Okay. If you've heard from Barb, Trish, and Sara how important it is to get involved with your Clean Power Plan environmental groups that are working in your state. And what the action for this month is exactly on that. We're sort of giving you a little bit of homework. Since the CPP action is moving to the state, now's the time to start raising the health voice in your state. How do you do that? Well, the best way is to connect with your state's CPP environmental coordinator. How do you find out about that? Well, one thing we're going to give you is you can email PSR National, and you see there the name of the person that you would be emailing, Colin Kearns. He will send you the contact name email of the PSR chapter/chat team leader, if there is one in your state. That way you can connect with them, because that's a very important first step. And second, he will also try to get you the name of the environmental organization that is coordinating CPP work in your state and get you that contact. Once you have that, you can then introduce yourself as a health professional PSR member who wishes to participate in the Clean Power Plan process in your state. I cannot emphasize enough how much it is going to be of importance for public health voice to be part of the stakeholders and the listening sessions and the roundtables that are required by the Clean Power Plan to happen within the next year. It is something that is in the plan that each state has to do that, and the states are scrambling to get listening sessions and briefings and roundtables set up. They are scrambling to get folks that have expertise in and also a different type of a voice to speak on these issues. So it is very important for you to be ready to do that. We believe that in the last few months, we have been preparing you through the webinars. If you have not been on these webinars, please go to our webpage and look for the chat climate health webinars. Let Barb know or Colin know if you need assistance and where to find them. So tomorrow you will be getting an email with a little bit more detail about this reaching out to your CPP environmental coordinator and how to do that. But
And
as I emphasize, yes.
And you're also going to be sending them the link to this webinar online as yet another resource in our series of webinars. Isn't that right?
Yes, they'll get everything. They'll get the link to this on the website plus information that you see here on the slide and some other info. Yes.
Great. Now, one of the transitions that's going to be taking place is that this is the final webinar that we're going to be doing in this series of monthly webinars about the Clean Power Plan. And if you'll think about the transition of the action to the state level, I think it will be very clear why. Our webinars over the past, 9 months now, have been nationwide. We've been talking about issues and aspects of the work that are relevant in all states, from the nature and the shape of the Clean Power Plan to the feasibility of renewable energy sources like wind and solar and the value of energy efficiency. Now things are going to become very much more state specific. The actors who are engaged will vary from state to state. The specific policy opportunities will vary, and the moments when you can bring forth your health voice will also vary, of course. So the way we work is going to be different. We'll be working with probably a smaller number of states and working more closely with those states so that we can give people in those states the information that is relevant to their state. It's a very fine-grained kind of information, not one size fits all. So that's what our staff is going to be working on in terms of providing, but we don't have the capacity to do that for every state. So I think that we'll be offering information and resources to all the states, but not on a regular monthly basis, on a much more periodic basis. Paz?
Yes, Julia, could you put the next slide, please? This is our final slide, and as you see there, it says moving forward in a time of transition, and it's talking about what Barb was saying. I want to cover a little bit about, since January, the webinars have covered topics from the introduction to the Clean Power Plan, renewables, wind and solar, energy efficiency, to effective and positive climate health communications and messaging. They're all up on the website. You can go watch them whenever you want. I want to thank all of you for being part of the process. I hope you have learned through these webinars how the Clean Power Plan presents us with the best opportunity in years to make an enormous impact in how the United States transitions to a clean and healthy energy economy. And though we may not be having monthly webinars, as Barb says, the work is going to continue. The shift is going to the states where the action really is. The emphasis will be a little different and happening in a different timetable from state to state. And so as we move forward, we will be working with the information and guidance to individual states. So please do not hesitate to ask us, to send emails, and ask questions to phone about how you can participate, how you can be involved. That's why our action today, it asks you to be in touch with the environmental CPP coordinator for your state. At this point, I'm also going to be announcing a little bit of a sad transition for me. I'll be leaving TSR as my position is ending due to a lack of funding. I'd like to say it's been a pleasure to work with all of you and be part of the Healthy Climate Solutions movement that PSR is leading. I want to wish all of you the best in this important endeavor. As I tell my children when they go off to sporting events or everything, I say good luck and also good effort. I know PSR gives the 100% effort. If you see there, you have Barb's email, and that is who we're asking that you be in touch with. Any questions regarding climate change work and the chats. So at this point, I say my final goodbye to all of you. I have enjoyed working and talking to many of you. Hopefully we'll cross paths again in the future. And I leave you tonight with nothing but wishes for success. Thanks, everybody.
Thank you, Paz. At
this point, we conclude our webinar for September. thank you, everyone, for participating. Look for your email tomorrow, and please take the action asked for. Good night.